Hello and welcome to Talk on Nevada. I'm Andy Matthews. The public option, on the table, off the table, what's going on in the healthcare debate and how is it going to affect you? That's the subject of this week's program, and joining me to help figure all of this out is Geoffrey Lawrence, a fiscal policy analyst with the Nevada Policy Research Institute. Jeff, welcome.
Always good to be here, Andy.
Okay, Jeff, for the benefit of our viewers, what are we talking about when we refer to the public option? If the final form of some bill that ends up getting passed includes this so-called public option, what's that going to mean?
Well, the public option is a central component of basically all three of the bills that are moving through Congress right now for healthcare reform. And basically what it would be is a government-run alternative to private health insurance. The President has talked about the need to compete with the private sector and introduce more competition into the industry. Public option is that vehicle.
And now the public option has been the source of some confusion and some controversy recently. Over the weekend, we heard Kathleen Sebelius, the Secretary of Health and Human Services, come out and say that it was not an essential part of the plan. The President himself said it's only a sliver of the health care plan. There seemed to be some backing away from it. Now some administration officials are coming out and saying, no, Kathleen Sebelius misspoke. The main point, we don't know how the politics of it is going to play out, but the main point here that I want to ask you about is, the President said, as you mentioned, that what we need is more competition. There isn't enough competition in healthcare. The public option would provide that kind of competition. As a free market guy, this ordinarily would be the kind of thing that you like. What's your beef with the public option?
Well, the public, there's certainly nothing wrong with greater competition. The problem with the public option is that it would compete on an unfair playing field. One of the significant fears that people expect would probably happen is that the public option would reimburse healthcare providers in the same way that Medicare does. Medicare currently under-reimburses providers by about 20% in most cases. So in order to make up that loss, healthcare providers have to charge more to private health insurers, which drives up premiums and makes it more difficult for private insurance companies to compete. So the fear is that the public option, because it's cross-subsidized by private plans, would eventually drive private plans out of the market and actually lead to less competition because the end result is that it would devolve into a government-run monopoly.
Okay, so from a free market perspective then, this public option would seem to contain some real problems. As I said, though, it's starting to look like possibly the public option may be stripped away. Does that mean that these various plans that are now circulating through Congress are going to be just fine? I mean, are they going to be more palatable to people like you who really want to see competition and want the government out of healthcare from a free market perspective? Are these plans going to be a lot better?
Well, there's two parts to that answer, Andy. The first is that even without the public option, the rest of the things that are included in these bills are kind of detestable on their own merits. That there's an individual mandate, there's an employer mandate, there's a bevy of new taxes and regulations which restrict freedom and put more of the healthcare decisions in the hands of government bureaucrats, taking it away from doctors and patients and their ability to make those decisions on their own. The second answer is that the public option really isn't off the table. What's going on is they're kind of playing games. They're now calling it a public cooperative, which it would amount to the same thing. Basically, it would be a nonprofit insurance company whose board the president would appoint, and the Congress kind of set the rules for it. There are currently hundreds of cooperatives already across the country that are nonprofit that provide health insurance. So this would just be a subsidized government alternative.
Now, people on your side of this debate often get accused of not offering alternatives. You're saying, no, we don't want this, we don't want that, but you're not offering any ideas of your own. From a free market perspective, how do you address some of the problems with our healthcare system?
Well, I certainly think that I have offered some alternatives, Andy, and some of the main ideas are that the president is right. There currently is not enough competition in the healthcare industry, and that's because state governments have restricted that competition. Currently, every state has their own set of mandates for health insurance. So if you want to purchase health insurance at all, you have to purchase coverage for a certain set of mandates. Could be as many as 50 mandates in some states, and that drives up the cost of healthcare. It also restricts competition because you can't go across state lines and purchase an insurance policy. For instance, I may find an insurance policy available in Kentucky that better suits my needs than what's available here in Nevada, but I'm not able to go purchase that. And because there's no competition in that way, each state basically has an oligopoly of insurance providers, which is extremely inefficient. A second reform that really should be pursued is one of the problems with health insurance currently is that health insurance is tied to your job, and that's an outcome of the U.S. tax code, because your employer is able to purchase insurance with pre-tax dollars, whereas you as an individual, if you want to purchase insurance on your own, you have to do so with after-tax dollars. So one of the reforms that could be made is to allow an individual to take that deduction on their taxes when they file individually. And this would kind of create a market that's catered more to the individual instead of some type of collective market geared towards the employer.
All right, well, that's all the time we have this week, Jeff. Thanks very much for joining us. And of course, I want to thank all of you for tuning in to this week's edition of Talk on Nevada. Please come back and join us next week. And in the meantime, check us out on the web at npri.org for more information on this topic and other private solutions to public challenges facing our silver state. Thanks, and we'll see you next time.